I call Scott Simpson.
Thank you, Mr Speaker. I'm delighted to take a call in this first reading of the Health Practitioners Replacement of Statutory References to Medical Practitioners Bill in the name of the very good and competent Minister of Health, Dr Jonathan Coleman. Now, sir, the previous member was obviously receiving some kind of incentive or award for mentioning the former Health Minister in the last Labor administration, Annette King, because I suspect that probably every mention received a chocolate fish or something along those lines. But I counted about 5 or 6 mentions, and of course some of us have been involved in the political system long enough to remember that when that member was the Minister of Health, we had people lined up in corridors under fluorescent tubes for days on end at North Shore Hospital, waiting to get a place in a hospital. It was a shocking and dreadful shambles. And so this government, sir, has been busy reforming health, making health more efficient, getting it so that, for instance, New Zealanders no longer have to travel overseas to receive cancer treatment as they did during the time of the Honourable Annette King's administration. But, sir, this bill particularly is of importance because it is reflective of the changes that have been occurring for a long number of years in our medical and health systems. Sir, my late mother was a registered nurse, and she practised her nursing at Waikato Hospital. And I well recall the many stories that she used to tell of how in those days when the most important things that nurses seemed to do was to starch linen and make beds and do everything that was ordered literally by the doctors, who were like gods, if you like, in our medical system. The nurses did the menial tasks, and the doctors and the senior medical physicians really did sort of administer a regime that was strict and controlled. And their judgment was never questioned. Their judgment was always the be-all and end-all of any medical intervention. Well, sir, things have changed a lot since the days that my mother was practising nursing at Waikato Hospital. And indeed, as my friend and colleague Andrew Bailey says, for the better. And much for the better, because these days there are so many aspects of our health interventions and procedures that can be done by very competent, skilled and well-trained people in the medical profession who actually are not general practitioners or doctors as such, but they do have the registration and the current education and training to ensure that they can provide all sorts of services and support for people needing that from our health system. This bill, sir, I want to make very clear, as I understand it, makes absolutely no increased risk of harm to the New Zealand public, with the scope of practice being set in every instance that this bill envisages by the relevant responsible authority and the professional accountability of each practitioner to be responsible for their actions and their deeds. So whilst we are moving forward in this area, there will be no lowering of standards or lack of protection for members of the public. It's an omnibus bill, sir, and it effectively amends 7 statutes that enable a wider range of suitably qualified health practitioners as defined under the Health Practitioners Competence Assurance Act of 2003 to undertake a wider range of functions than they are currently able to do and that are currently restricted to medical practitioners. Sir, this government has spent a lot of time in its 7 years of government in ensuring that our health dollars go further and that we get better results. Because under the last Labor administration, we had a doubling of health spending, but a reduction in actual results for New Zealanders. And that, of course, needed to change, and it needed to change in a significant way. And I'm very proud to be part of a government that has worked diligently, both during the time of the Honourable Tony Ryle, during his administration as Health Minister, and now being carried forward by Dr Jonathan Coleman in his portfolio responsible areas. This is a government, sir, that's completely committed to delivering much higher quality services for all New Zealanders, no matter where they live. And a previous speaker in this debate, my colleague Jackie Dean, who, like me, represents a provincial rural electorate, these are matters that are of concern to constituents in seats like the Coromandel, because often the bricks and mortar hospitals are actually quite a long way physically from where the patients are. And so the increasing focus is upon ensuring that people can receive the benefits of health and medical advice and intervention in their own communities or indeed in their own homes. And what this bill seeks to do, sir, is to provide a much greater role for community health providers like our nurses and our pharmacists. And nurses and pharmacists, of course, have an ability to operate neatly and easily within communities, local communities, often in places that are geographically isolated and some distance away from base hospitals. So by making these changes and by ensuring that we have a greater role for instance, pharmacists and nurses, there will be a better supply of health benefits to a wider range of people in our more far-flung rural and provincial communities, because this is a government that is just as concerned about supplying good public services to people in the provinces as it is to the cities. This national-led government, of course, sir, has put a very big emphasis on increasing the numbers of doctors and nurses within our health system, who are now able to be working within our broader communities. They're working hard to ensure that better services are provided to a much wider range of people. We have now, sir, over 3,000 enrolled nurses registered to practice across all areas of our health sector. There are 3,000 enrolled nurses, 3,000, Mr Bishop, and that is a large number of capable, talented, professionally competent nurses who can do a whole range of things that have previously just been the protected preserve of the medical practitioners. So we now have a total of more than 40,000 nurses. So the 3,000 enrolled nurses goes to make up the total of 40,000 nurses working in New Zealand's health system, and they, of course, perform a very vital role. So the changes under this legislation will allow this highly skilled workforce with the appropriate knowledge, training and professional background to treat and look after patients within our communities. And I, sir, think that that is a very good step. It's something that has probably been in the winds for a long time. But we needed to make sure that it was the right time to introduce this legislation. As a member of the Health Select Committee, I'm very much looking forward to a thorough and diligent investigation of this legislation. I know that committee members on the government side will be doing that, and I hasten to add that the Health Select Committee is a very collegial committee, and I know that with the support of Labor members who have indicated that they are going to support this bill through the Parliament, then I think that we will ensure a very good Select Committee process under the capable chairmanship of Simon O'Connor. Sir, one of the things that has been most obvious over the last few years is that in many other countries, health and health spending have been cut. Services to health have been cut. That has not occurred in New Zealand, and I'm very proud, sir, to be part of a government that has, during the very toughest of economic times, when there has been enormous global financial pressure, that this government has, in every single one of its 7 budgets, increased health spending and increase the effectiveness and services to New Zealanders who require the use of our health system. So this appears to me to be a very good bill. I'm looking forward to the scrutiny that the Select Committee will give it, and I commend it to the House.